Welcome to this educational video on Niemann-Pick disease, a rare and devastating group of inherited metabolic disorders. We'll explore the underlying causes, the mechanisms of the disease, the symptoms, how it's diagnosed and managed, and the ongoing research aimed at finding better treatments and perhaps, one day, a cure. Join us as we delve into the complexities of Niemann-Pick disease. Niemann-Pick disease isn't caused by a single thing, but rather by genetic mutations. These mutations occur in genes that provide instructions for enzymes responsible for processing lipids, specifically sphingomyelin and cholesterol, within the lysosomes of our cells. Lysosomes are like the recycling centers of the cell, and when these enzymes don't work properly due to the mutations, lipids accumulate to toxic levels, leading to cell damage and dysfunction. In essence, it's a genetic error that disrupts the cell's ability to break down certain fats. The pathophysiology of Niemann-Pick disease revolves around the accumulation of sphingomyelin and cholesterol within lysosomes. This buildup disrupts normal cellular function in various organs, including the brain, liver, spleen, and bone marrow. This lipid overload leads to enlarged organs, particularly the liver and spleen. Neurological deterioration as affected neurons are suffocated by the fatty build-up, and bone marrow dysfunction, which can cause blood abnormalities. The specific organs affected and the severity of the damage depend on the type of Niemann-Pick disease and the specific genetic mutation involved. The body's natural waste disposal system becomes overwhelmed, leading to progressive and debilitating symptoms. Niemann-Pick disease is considered a rare disorder. The exact incidence varies depending on the type and population studied. It is estimated to affect 1 in 40,000 to 250 live births, making it an ultra-rare disease. Certain subtypes like type A are more prevalent in specific populations, such as those of Ashkenazi Jewish descent. Due to its rarity, diagnosis can be challenging, and many healthcare professionals may not be familiar with the disease. Improved diagnostic techniques are gradually increasing awareness and earlier identification. The signs and symptoms of Niemann-Pick disease can vary significantly depending on the type and severity of the condition. Common symptoms include an enlarged liver and spleen, feeding difficulties, developmental delays, and progressive loss of motor skills. Neurological symptoms are often prominent, manifesting as intellectual disability, seizures, muscle stiffness, and problems with coordination. A characteristic cherry red spot in the retina may be observed during an eye exam, particularly in type A. As the disease progresses, individuals may experience breathing difficulties, lung disease, and bone marrow problems leading to anemia or thrombocytopenia. The spectrum of symptoms can make early diagnosis difficult, highlighting the need for comprehensive evaluations. Diagnosing Niemann-Pick disease typically involves a combination of clinical evaluation, enzyme assays, and genetic testing. Doctors start by assessing the patient's symptoms and medical history. Blood tests can measure the levels of sphingomyelinase or other related enzymes to see if they are deficient. A bone marrow biopsy may reveal foam cells, which are cells engorged with accumulated lipids. Genetic testing can confirm the diagnosis by identifying the specific mutations in the genes responsible for the disease. Prenatal testing is also available for families with a known history of Niemann-Pick disease to determine if the fetus is affected. Niemann-Pick disease is classified into several types, each with its own underlying cause and clinical presentation. The most common types are Niemann-Pick disease types A and B, both caused by mutations in the SMPD1 gene, leading to a deficiency in acid sphingomyelinase. Type C is caused by mutations in the MPC1 or MPC2 genes, affecting cholesterol trafficking within the cell. Type A is the most severe form, with rapid neurological deterioration in infancy. Type B presents with organomegaly, particularly an enlarged liver and spleen, and varying degrees of lung involvement. Type C has a more variable presentation, with neurological symptoms appearing at different ages, from infancy to adulthood. Recognizing the different types is crucial for accurate diagnosis and management planning. Currently, there is no cure for Niemann-Pick disease. Treatment focuses on managing the symptoms and providing supportive care to improve the patient's quality of life. This includes nutritional support, physical and occupational therapy, and medications to manage seizures or other neurological symptoms. Enzyme replacement therapy is available for some types of Niemann-Pick disease, aiming to provide the missing enzyme and reduce lipid accumulation. Hematopoietic stem cell transplantation is being investigated as a potential treatment option for some individuals. The goal is to alleviate the symptoms, slow disease progression, and provide the best possible support for affected individuals and their families. As Niemann-Pick disease is a genetic disorder, there is currently no way to prevent the disease itself. However, genetic counseling and carrier testing can help prospective parents understand their risk of having a child with the condition. If both parents are carriers of a Niemann Niemann-Pick disease gene mutation, there is a 25% chance with each pregnancy that their child will inherit the disease. Prenatal testing options, such as chorionic villus sampling or amniocentesis, can determine if a fetus is affected. Informed reproductive choices, based on a thorough understanding of the genetic risks, are the main preventative measures available. The prognosis for Niemann-Pick disease varies significantly depending on the type and severity. Type A is typically the most severe, with a very poor prognosis and a lifespan often limited to early childhood. Type B has a more variable course, with some individuals living into adulthood with proper management. Type C also has a variable prognosis, depending on the age of onset and the severity of neurological involvement. Recent research efforts are focused on developing new therapies, including gene therapy and small molecule drugs, to correct the underlying genetic defects or reduce lipid accumulation. While a cure remains elusive, ongoing research offers hope for improved treatments and outcomes for individuals living with Niemann-Pick disease.